So today we're asking, are COVID passes going to make our life easier in the long run? We're now joined by Jenkins, an independent statistician who was former head of health analysis at the Office for National Statistics. Jamie, you're based in Wales. Are you pleased to see COVID passports?
Well, no, I'm not actually. And I think one of the questions you just posed there, will it make life easier? Well, of course, if you're having to go away now, download kind of a pass, you've got to prove your vaccination status. I just think this is a significant burden on business. And there's a couple of issues I do have with them actually overall. In that, the first one is that when you're looking at kind of data protection across the UK, the medical data is actually given a kind of a special kind of accreditation. It's called a special category. And what we're going to be doing perhaps with some businesses, not potentially the ones where you just rock up and show your barcode outdoors and then they scan it or whatever, but there'll probably be some events where you have to pre-book and show that you've had these you've got a COVID pass, and some of this information might be held by businesses, puts a lot of burden on them. Then there's going to be all the queues for people to get into these events, in the nightclubs. There's a big football match in Wales this weekend, I think in Cardiff are playing Swansea, and there's going to be huge queues in terms of thousands and thousands of people trying to get in. And it all comes back then down to what's the evidence to support bringing them in. Now, this is not kind of people who are against vaccine passports or vaccine passports. This isn't people who are kind of anti-vaccine. I've had both jabs. I think the main issue you've got here now is this is kind of stepping over the line. And the Welsh Government's own scientific advice given to them was that even with careful planning and application, there may not be any net benefit to the introduction of these. They also said that the policy itself could backfire because it breeds kind of distrust with government. And because we know that if you are vaccinated, you can still pass the kind of COVID on to other people, it also probably puts that false sense of security in that, oh, if everybody in this venue today has had a kind of vaccinated, I'm going to be safe. So I think there's a fundamental issues with all of these. And it all comes back to, I think, for me, what is the net benefit of doing this? What's the scientific evidence? The government say they're following the science, but in this one, they clearly haven't been doing that.
More broadly, Jamie, I mean, I'm a supporter of, Scottish devolution, the Welsh Assembly and so on, within the context of a broader United Kingdom. But does it really make sense to have, when you have countries that are, very, very close culturally, geographically, no sea border, completely porous land borders, rightly so. Does it make sense to have different COVID policies? I've always wondered what the Scottish Government's been doing, what the Welsh Assembly's been doing. Isn't it partly about playing political games to try and outflank Boris Johnson's Conservatives in England?
I think you bang on the money there. I've been quite critical of Boris Johnson's government at times throughout the last 18 months, and the Scottish Government and the Welsh Government. At times, I think there have been different policies for political sake, just to say that we can do things differently. You've got a porous border. You just take Wales, for example, and England. You're going to get a lot of people in South Wales who might think, well, I'll take my business over to England. It'll damage Wales businesses there. And you've got the same in North and Mid Wales as well. And ultimately, the virus kind of, when it spreads across the country, it doesn't discriminate with borders. So having all of these different policies in different places, where I've lived in Wales, we've had policies where you couldn't go more than 5 miles, where children couldn't play football, whereas over the border in England, you've kind of had fewer restrictions. We've still got the same now with kind of masks in Wales, where in kind of shopping centres and the like, where they don't have them in England. And the virus does seem to be kind of evolution of the virus is different across Wales and England. Ironically, when Wales had more restrictions in recent months, cases have gone up and they've fallen in kind of England as well. So I think having these different policies, I believe that, as for a national pandemic like this, it would have been far better from the start that if the first ministers of Wales in Scotland and the Northern Ireland executive had got round the table, potentially at some of these COBRA meetings, and we had a national UK approach, it would have been far more sensible than having this different approach in different countries, because there's going to be people coming over from England into Wales, or going from England into Scotland, who are going to be completely kind of blindsided by this. That's going to cause an issue. And then you're going to get the people who are going to leave Scotland and Wales and go over to England to avoid it as well. So yeah, I think you bang on the money there. These different policies just haven't made sense from the start, I don't think.
Reasons that you gave for questioning the COVID passport is that vaccines don't prevent transmission. Would you support a lateral flow test then instead as a precondition for entry into a large-scale event?
Well, I think the lateral flow test policy itself, is a bit flawed as well, because the Plaid Cymru, who voted against them, so these are the Nationalist Party in Wales, they voted against introducing them, not because they didn't like the approach of having vaccine passes. They didn't like actually the workaround where you could show a negative lateral flow test to get in. Now, the lateral flow tests themselves are open to a lot of abuse, because how do you prove that somebody has done the actual lateral flow test properly? You know, they could have just put water on the lateral flow test and come up with a negative lateral flow test. So that's one of the issues with regards to, I think they've gone down this approach in Wales so that it kind of says that, well, if you haven't had a vaccine, there is a workaround for you, but that's open to abuse. I just don't think we need these vaccine passports or passes in the first place, because it's quite clear you can still catch the virus and pass it on. Now, you know, people can look at my Twitter feed. I'm always updating the daily stats on all this. It's quite clear the vaccines have a huge impact on reducing the number of hospitalizations and deaths. But for those in much younger age groups, you know, the benefit of those is significantly lower than those at older age groups. So I think bringing these passports in, you know, is this one step towards something else? That's a big concern for me, and with regards to all of this. And it just comes back to what I've said earlier on. They keep saying we're following the science, and the Welsh Government's own scientific advisors have not put any benefit to this policy. And if you're going to be going back to the public to say, well, we're carefully following the science, where is the evidence to support this policy, which is a huge one that's been introduced in Wales today?
Jamie Jenkins, thanks for that contribution. Independent statistician and, very significantly, the former head of health analytics at the Office for National Statistics.